I'll bring him in when I bring everybody in.
I mean, okay.
You should have the link now.
All right, putting an email come through. Oh, there it is. All right, let me go verify that it's working.
And
New-
Jacinta,
it's Olivia.
somebody says they're having trouble signing in. Do you have anybody in the waiting area?
I'm
yes,
bringing him
Ivan.
now. I was waiting to bring everybody in, so if you can wait till I bring you in next time, we'll bring you in once we're live.
All right.
Mhm.
All right, we're good, we're live.
Warren's coming back in. I guess he had some issues.
I think Warren's in. I think you got everybody in.
Yeah, I'm in.
Yes,
Sorry
sir.
about that. All right, so ready to call the meeting to order. Will everyone introduce themselves for the record and we'll test the audio? You want to start, Dr. Dames?
This is Dr. Rob Dames, and I'm a child, adolescent, adult psychiatrist in New Orleans.
Warren Lowe, medical psychologist, Lafayette.
Chris Rochelle, medical psychologist, Thibodeau.
Darla Burnett, medical psychologist in Baton Rouge.
Come in, Glenn. Are you there? Guess we lost sound with Glenn. We got to. All right, he's here. You're kind of breaking up on us, Glenn. I don't know if you can hear. All right, we have a quorum, and I presume that we meet the that the agenda meets the criteria.
Yes, sir, it does.
Do we have any public comments?
I'll check right now and let you know in a second. One moment, please, sir.
Yeah, we know.
Warren, there was the only one public comment. I did send it to you in your agenda. That one was sent before the meeting, if you would like to read it, or Dr. Collada would want to put it on the screen.
Yeah,
But
we
there
have
is-
that. We have that one.
Yeah, but there's none at this time other than the one that was sent in advance.
The one that was sent by mail or text. Yeah,
Yes,
and that is on the agenda.
correct.
Under old business. So no public comments.
None at this time.
That approval of the minutes from our last meeting. There, Chris, you and Glenn weren't at that meeting, and it was a frustrating, disappointing meeting because we had so many problems with the applications. But I think there were 9 applicants, and only one of them was approved, and most of them were short on CME hours. For a whole variety of reasons, mostly not reading the instructions. And there was a great wailing and gnashing of teeth afterwards, like, why didn't anyone tell me I couldn't use telehealth for my psychotropic CME? Or why couldn't I use cognitive behavior therapy for my psychotropic CME? But I talked to 6 of the 8 people who had deficiencies and carefully went over what the requirement was. It wasn't just CME, it had to be CME that was particularly geared toward the use of psychotropic medications in the treatment of mental and nervous disorders. So ACL injuries and D1 athletes didn't count. And there were some people that one person actually submitted CE and CME and even labeled it for us, which
Mhm.
made it quite easy to see that since you had about 50% of each, you're not going to make it. I think they understand now what the requirement is. These people do. We'll try to do a better job of educating those people that are coming along. But what was frustrating in talking with some of these people is, why weren't we told this before? Well, there's been 2 workshops on filling out the advanced practice application. I guess these people slept through it. And actually 3 of them use that as one of their CMEs for psychotropic medications. So it's not like we haven't tried. We have, but we'll keep working at it and hopefully avoid a situation like we had at that last meeting. What the minutes reflect, Darla, is that we
I was gonna say, I did find one actual typographical error in the minutes. If you go down to number 7, it says need form signed for 10 hours versus 100 hours of CME.
okay. We did pass one of the 9 people, and I don't see that on there.
Yeah,
is
it was number
4.
4. Number 4, Warren.
Yeah.
Oh, okay. Okay. Sorry. Just missed it. Okay. That was Dr. Nevin, Doris Nevin. Okay. Good. Okay. So really, all that needs to be done, I think, with the minutes is they just need to be formatted because, Van, don't we make these motions after we come out of executive session?
Make the motions based around a number and we don't identify the person, and any recommendations can be included, but the motions are out of, in public session without identifying the person that you're making the motion about, only using a number referenced in the minutes or preferably the licensing tracking number that we have. We can use that as well.
So on number 4, can we use, since that was approved unanimously, can we use her name?
Patricia, you want to comment on that?
There's not really any point to. I mean, you can, but it's not necessary.
Okay, okay. So really, these are all these motions are all under executive session, but they were actually after we came out of executive session, correct?
They're executive session minutes, okay? And that's what they reflect.
Got you. Okay. Right, good enough. So I think we can move on. Under old business, we have status of law revisions, and we've had
Warren,
some
before
discussion.
you move on, can you make a motion to approve your minutes? I did fix the one
Oh.
error. But
Yeah, I'll move to approve the amended minutes.
Dr. Rochelle, second.
I would like to, yeah, okay, all in favor?
Aye.
I'd like to change the agenda. Maybe I should have made this motion at the beginning, but I'd like to move the status of law revisions into executive session, since that's a legislative matter.
Yes.
Let me ask you this. Normally, we do not allow executive matters to be unless you're getting legal advice. Is it your intent to ask Ms. Wilton legal advice?
Possibly.
They-
I mean, it's hard to say. I mean, I certainly value her input.
What Dr. Collada is saying is that a general discussion about legislative plans or possible legislation is not one of the exceptions to the open meetings law, and that discussion should be had in public.
Okay, we'll just have it in public then. There's a committee that's been formed. David Thomason is the chair of it, and it's a committee to revise the licensing statute. And there are 4 or 5 areas that are being looked at. One is just to clean up all the language about the transition from the medical psychologists who were initially licensed under LSBEP that transitioned to LSBME. That's all in the past now. Prescriptive authority certificates no longer exist. So we want to just get rid of all that language. It's just housekeeping. The other thing that we want to do, which has come up and it has been a little bit of a roadblock for us for a while, was that requirement for maintaining licensure with LSBME, with LSBEP when applying for advanced practice. And we have an opinion on that, but we'd like to clarify it in the statute too. So we're working on that language. We want to, we also have an opinion from the board about taking referrals from NPs and PAs, as long as we're involving the supervising or collaborative physician. But we'd like to get that into the statute. We're going to, we're still taking a look at the CME, CE. Seems to be a consensus that people want to keep that distinction between the two and require both. And so I don't know that there's going to be a big change there. I did have a question, Van. I think you had mentioned at one time that the test on the law and the rules was going to become a requirement for all licensees.
That is correct.
And that can be counted as ethics.
It can be counted as continuing education. And if you want to call it ethics, we can do it for you, but it is free CME that can be used to fulfill requirements that the board sets for all the other classes, and it should be for you. But I don't think it can be CE and CME. It's got to be one or the other.
Yeah. CE broker made that clear. It's got to be. But it's not yet a requirement, but it will be.
It's a requirement as we speak.
Okay. Okay. Do we need to put that in the statute or not?
I think that's something you ought to leave in the rules.
Okay. Okay.
Can I I need to ask a question, Warren.
Sure.
I don't think that the board is really unhappy with you wanting to change the law. Procedurally, what I would like to see happen is that I'm sure you have lobbyists who agree with the law, but really doesn't understand the subtleties of the regulative side of this. And it might be helpful if whoever's drafting the law for you, we can work with them to make sure it meets all of the nitpicky little things about regulation that we have to do so that we don't get at cross purposes. I just don't want to, I'd like to have a unified document that everybody agrees to and that everybody can say, oh, we got no problem with it and move on.
That's what we want. And that's why I'm trying to keep the foot on the pedal so we can get this to you as soon as possible.
Okay. And as your people start drafting, they can send, drafts to us and we can comment on it and send it back to them.
Okay. Drafts to you and Patricia?
That'd be great. Thank you.
Okay. All right. We do have some language already, so try to get that to you. And then the last area on the revision of the statute is defining clinical experience for MP applicants. Right now, any psychologist, regardless of their training, if they go and pass the PEP, get a master's degree, they can become a medical psychologist. And that was not the intent. We had some language in there. It disappeared somehow. But we're trying to define the requirements for internships, training, that kind of thing, so that it will rule out someone who's never laid eyes on a patient throughout their training. And that's basically it. I mean, there's no big changes to it. Most of it's housekeeping. So I think it should be clear sailing. Bud seems to think there might not even be the need for testimony. We'll be prepared one way or the other.
Well, I think we can vitiate a lot of those concerns if Bud can go to the table and said, we've drafted this in conjunction with the LSPME and they're in agreement with the language. I think that's going to go a long way.
That's what we want to do. Okay. So I think that's, public comment. We got another, remember we had a previous communication from Mark Zimmerman. And here's that previous comment was about the inability of CE broker to accept CE or CME for ethics, which is allowed by our law or Rule 1. But CE broker couldn't ever quite get that worked out. He was complaining about that. But with the rules course, I think we can bypass all that. This has to do, have all of you read the letter?
Yeah.
It's really more something that should be directed to Lamp. And he says he's tried to, I will call Julie after this meeting and see if she can communicate with Mark and get him the information he wants. I don't think we need to take any action on it unless someone else feels differently.
My only thought, Warren, was that depending on when he's trying to get his hours completed, which I think all of us have a couple more months before we have to renew.
June.
I would maybe consider a waiver for one time because he had trouble scheduling, but not indefinitely. And I do think we need to communicate to Lamp that if they're going to be a CE provider in the law, they need to make sure people who are non-members have a way of accessing that.
Right.
And I think we can easily fix that.
I agree with that because they're risking their status if they don't. But we do have 2 more CE meetings this year. Plus, there are the virtual offerings online too from
Right.
Lamp now. So he should have no trouble getting his 5 hours. He's got two CE conferences to choose from, plus the virtual hours.
May I ask a question real quick?
Sure.
On our website, what I mean by the LPMA website, anybody who's interested in attending our scientific meetings, it's usually an event and you don't have to be a member to just click on it. And if you want to register, you can register, and you can register as a non-member or a member. And my question is, does Lamp's website have that capacity to have non-members visit and register for meetings, or is that not occurring at present? Is that why Dr. Zimmerman was complaining?
You know, I'm not familiar enough with the website here recently to comment on that. Darla or Glenn probably could.
So I can tell you, I'm looking at it right now. When I go to the meeting link, it requires a login for my username. However, on the web page, a home page, it says conferences, 2024 winter conferences. For more information, I can click there, I can register there. It's not requiring any login information. So it seems to me that he could register. Yeah, the registration button's popping up without me logging in. The dates are there. So it should be, to answer your question, it should be accessible to non-members.
I think the concern he has maybe is that he hasn't seen the agenda yet for this coming conference. Well, nobody's seen the agenda yet. We had some cancellations and speakers, and so I think Julie and probably Jesse are scrambling to get speakers. So I'm glad you found that, Chris. We'll,
Sure.
we'll point, I'll have Julie call him directly though.
I'm gonna say, I pulled it up just as Chris was pulling it up, and you cannot register for the conference on the version I was looking at unless you do have a login. But it clearly lists the conference times and dates, and it says you, it tells you to contact them if you can't get on. And maybe that's the problem he's had, is he's tried to contact them and says he can't get them.
Well, that's a problem for LAMP to fix. They can get Julie to make a slot for non-members to register and pay.
Darla, did you click on in the homepage at the bottom where it says 2024 Winter Conference
Yeah.
register?
When I
And it-
click register now, it says I have to enter my email, member ID or username and a password.
You know why? Because it had automatically logged me in.
Yeah,
Okay, yeah, they're gonna probably need to fix that.
Warren,
Yeah,
it does present a bit of a problem if we require it and he can't get it. So we need to fix that as soon as you can and let us know.
Yeah,
okay.
Yeah, I would agree though that the reason I asked the question was, first of all, is there something that needs to be fixed? And obviously there is. But I also wanted to see whether, the idea of an exception for right now is appropriate for this gentleman. And I think that since we see today that you can't really go on and register, that the exception this one time is worthwhile, with the understanding that LAMP's going to go ahead and correct this.
Well, Mark and I have talked a few times and he's very, very nice, but he says, I'm not going to join that organization. And if I have to, I'll take you to court. And I understand. And I felt very comfortable with that.
Sure.
But again, I think the key is that he feels that this is forcing him to join an organization he doesn't want to join. So
Well,
if we can address that, I think we'll be fine.
yeah, he's certainly not forced to join LAMP. We have, I shouldn't say we've got some board members from LAMP here, but there are fees for non-members to attend conferences. They're not excluded in any way from conferences.
correct.
Well, we just have to make that, have to ask them to update that webpage more clearly, send him a link to who to contact, or
Correct.
have somebody from LAMP reach out to him, and that'll
Mhm.
solve this problem and
Conferences,
prevent it in the
they
future.
can,
I'll take care of that today. I'll call Julie.
Great, thank you.
Okay. All right, next item on the agenda, I think we're down to our executive session.
So we
Anybody
need a
wanna make a motion?
to executive session.
Motion?
So moved.
All right, all in favor, let's move.
Aye. We're going to a breakout room.
Yeah, she's gonna move us in just a second.
Yeah, give me a second.
hello,
Yeah, Glenn?
can everyone hear me?
You're breaking up.
Yeah. Yeah. Yeah.
You should be able to join now.
So we hit join.
Yes, sir.
Can everyone
I can hear you, Glenn. You're just kind of breaking up.
hear?
Dr. James, please press join at the bottom so you can go to the gathering room for the executive session. All right, Tracy, I'm leaving you out.
Okay. You still with me? No.
We're just waiting on Dr. Alley to come over, looks like.
He's dealing with his,
Mr. Chairman, you have no comments at this time.
there are none, Van, is that what you
There are
said?
no public comments at this time.
Good, thank you. We have some motions to make on applications for certificates of advanced practice.
I'd like to motion that tracking number 126894 be recommended to the full board for approval for advanced practice.
Second.
All in favor?
Aye.
Aye. I'd also like
Right.
to recommend that tracking number 161383 be recommended to the full board for approval for advanced practice.
Second.
All in favor?
Aye.
Aye. Also recommend that tracking number 116628 be recommended to the full board for approval for advanced practice.
Second.
All in favor?
Aye.
All right.
Also would like to recommend tracking number 278360 to the full board for approval for advanced practice.
Second.
All in favor? Aye.
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 Also will recommend tracking number 278110 to the full board for approval for advanced practice.
Second.
All in favor?
Aye.
Aye.
Also will recommend tracking number 277943 to the full board for approval for advanced practice.
Second.
Favor? All in
Aye.
favor?
And then lastly, I'd like to recommend tracking number 103478 to the full board for recommendation for approval for advanced practice.
Second.
All in favor?
Aye.
And then, were you gonna make the last motion, Darla, about the,
Yeah, well, I can do that. I would
Okay.
like to motion for a policy that the impact accept and suggest a policy to the board that all applications for advanced practice must be completed on LSBME application forms and may be rejected if not done so.
second?
Second.
Would you accept a friendly amendment to will be
Sure.
rejected?
Will be. I just wanted
Will
to
be
give the
rejected.
board some.
But then that
Will
means
be.
you're gonna have to look at each one and decide whether you
Right,
will
no,
or
no, no,
you
yeah,
won't.
you're right, no. Yeah,
I'm
and
sorry.
will be rejected if not done so.
And Ms. LaShonda, just so you could make us all clear, is there a fee attached to that application?
For advanced practice?
Yes.
Let me see.
Yes.
There is.
And is it paid at the time they submit?
Yes, sir. It's $175.
All right, so we can do one of two things. We can, if it's sent in the wrong form, we are not supposed to give refunds, okay? And anybody that wanted a refund the board would have to approve it. They did it wrong, okay? And we'll make sure that the instructions are clear that they have to do it in a proper fashion. What does the advisory committee think? Do you want us to ask the board to accept the rule and give them a refund? Or do you want to just simply say, you did it wrong, you have to resubmit it, and a new fee has to be paid? How do you want to handle that?
Well, with our current track record, Van, if they had to pay again, you might not have to raise those licensing fees you're thinking about.
Yeah, and I would say to be consistent, everybody else who does it wrong submits a non-conforming application, they have to pay again and they don't get their money back. So,
Okay,
Just so
well,
you'll know, we do it for
it's
everybody else.
a good way to get someone's attention.
All right,
Yeah.
we'll make sure that the trick is, and
Fair
we'll have,
Yeah.
as Ms. LaShonda, you and I need to get together, and Ms. Stewart rather, you and I need to get together and talk to Ms. Susie to put the instructions in there that y'all are going to send us. And Glenn, I suggested either you or Warren put the language together or the points you want in it, and we'll have Susie tune it up to make it nice and pretty, and then we'll amend that into the application instructions.
So do we need to make a motion that we retain their application fee and a second one needs to be submitted? Or is a motion not necessary?
Well, that's the process, that's the policy of the agency. I just want to tell you. And again, everyone would then be an exception that would have to go to the board, and the board would have to decide, okay?
Okay.
But again, it's one of those things that we are not supposed to give refunds because you make a mistake as an applicant.
Good.
Okay.
Can I suggest another friendly amendment to that language? Can we, so there's no question, there's no confusion, can we specify the title of each of those forms? Because I'm seeing clinical experience documentation is labeled, and then CME documentation form. Can we just maybe add that language in there?
Certainly,
motion.
that's why I'm going to trust you and or Warren and Glenn to send the points that you want in the instructions, and we'll put them in exactly like you said. We may just dress the language up to be, easily read, but the points you want to make, we will put in.
Okay.
Now, I don't think it has to be in the motion because it says
No.
LSBME application forms,
That's
Right.
right.
plural.
That's right.
So,
So you're
Dan,
good?
the next meeting of the LSBME is on the 22nd.
Of this month, yes, sir.
So these applications that we approved today will go before the board then.
I have every intention of trying to get them on the agenda. You bet.
Thank you, thank you. Any other business, or can you tell us how much our licensing fees are gonna go up?
Any comment, public?
Well, let me say to you all that that's the $64,000 question, because my board can't make a decision about anything right now. They're still struggling with very disparate views, and nobody really wants to stick their neck out. So we may be doing some other things to save money and, not take a fee increase, but it's going to be very interesting to see what the board does.
I would just like to say publicly that I enjoyed today's meeting way more than the last meeting because we got to approve some people.
Absolutely.
Well,
Very good.
and
I
hopefully we
second
won't
that
have to go through these
emotion. I
steps.
second that emotion.
Hopefully, we won't have
Any,
to go through
feedback
these
or-
steps every time.
Any questions or comments from the public?
So we
None.
don't,
Address?
we don't have any applicants pending, correct?
Just
Not that-
one.
Only Chandler's,
Only an individual who shall not
only
be.
in individuals, I'm sorry.
Oh,
Okay.
That's the only one I'm aware of. Okay, motion for adjournment.
so moved.
All right. Thank you, everybody. Have a
Thank
good
you. Happy
weekend.
New Year, everybody.
You do the same.
Yes, Happy New Year.
Stay warm.
Thank
Be
you.
safe. Happy Mardi Gras.
Bye-bye.
Oh, for sure.
Right.